Hello everyone, Gary Raze here with Eugene Spotlights, and today we're going to interview Dr. Nick Jones here with Clear Health Direct Primary Care. So let's go on in and meet the doctor. Hi there,
Welcome, Dr. Jones.
Gary Raze, good to meet you.
Good to meet you too. Welcome to our office. We try and make it a lot more welcoming, and one of the studies that I like to reference is how hospital rooms that have a window facing the outdoors versus a window facing a brick wall actually have better outcomes for patients. So I use that and have plenty of plans for patients to come in and enjoy while they wait or check in with their staff. And it just makes it more welcoming. Helps get rid of white coat high blood pressure.
So take us on a tour.
Absolutely. One of the first things that you'll see is a bookshelf here. I have a lot of time to go into health-related topics with patients, and I often find that their physical health is directly related to their mental health. And if you dig a little deeper, there may be other financial underpinnings, there may be substance use like alcohol underpinnings, or even just anxiety and worry about the climate. And so sometimes a pill and therapy may be appropriate. Other times you just have to get out of debt. So that's where I have financial books, cookbooks, books on breathing, on sleep, on the immune system, on alcohol. All of these books I've read and personally recommend, and pairing the right book with the right patient is a huge part of what I do. Right here at our front desk, we have where my medical assistant sits. She works part-time. She's studying to become a registered nurse, which I'm absolutely happy to accommodate. We've got a wheelchair accessible bathroom for patients straight ahead. And this way, we have 3 exam rooms. I do my own procedures, so I've got 2 exam tables, and I'm ultrasound medicine trained. And so we've got an ultrasound machine where I can help do ultrasound guided joint injections, I can diagnose gallstones, I can check for blood clots, evaluate abscesses, all those sorts of things. And this is where the magic happens. This is where I have my consultations with patients. We've got plenty of windows, we get some sunlight, and all new patient visits are at least 60 minutes, and if there's nobody scheduled after, it's 90. And with that time, we can go into where your health has been, where it is now, and where you'd like for it to go. And so setting goals is incredibly important, and that's a big part of what we do in this room right here.
Hello everyone, I'm Gary Raze, and here again with Eugene Spotlights, where we're interviewing Dr. Nick Jones, and he is going to talk to us about some pretty revolutionary, I should say, medical practices, and he's here with Clear Health Direct Primary Care. That's a mouthful. So, Dr. Jones, it's good to meet you.
Good to meet you too. I'm happy to be here and raise awareness for this style of practice called direct primary care.
Well, and that's interesting because I know that there's going to be a lot of people, especially in this area, that are open-minded, mm-hmm. and they are looking for better ways to manage their health care. And of course, with the situation with the difficulties of getting to see doctors and so on, you may have a situation that really helps our community. Could you tell us about your journey and how you decided to go this particular path, and explain what you do?
Yeah, absolutely. I'd love to. So I come from a family of school teachers. A lot of my mom's side of the family are in education. My dad drives trucks for FedEx. Mm-hmm. All I knew about doctors was when I got a cold as an only child, not only did he make me feel better, but he made my parents feel better, right? And so having an aptitude for science, I always knew that I wanted to go into medicine. In medical school, you know, the old cliche of drinking through a fire hose is absolutely true. I was sheerly focused on learning. And there were times when I thought I could be a surgeon, a transplant surgeon, a trauma surgeon, or a psychiatrist, a neurologist, a hospital doctor, ER doctor. But when a mentor told me that family medicine can do it all, that's the route that I gravitated towards. And in residency, I was one of those weird residents that actually enjoyed it, right? It's 80 hours a week. I was alternating between 10 and 16-hour days, 6 days a week. But the people that you're helping are uninsured or underinsured, juggling part-time jobs, nowhere else to go. And so I did my residency in Corpus Christi, Texas. And so it was incredibly difficult to get in to see a specialist. Oftentimes people would need to take a bus to Houston or San Antonio, 250 miles away. So whether it was lupus, rheumatoid arthritis, type 1 diabetes, we had to look it up and we had to figure it out. Now, one of the benefits was that we had federal funding, state funding, county funding, and you could pay the residents minimum wage pretty much. And so I never had to think about the finances. Well, fast forward to the real world, and you're in this environment where the only incentives are how many people can you see a day, or how complex can you make them seem when you're billing an insurance bill. And so I never trained that way. My brain doesn't work that way, and it was very difficult to make any types of incentives or bonuses. But I was fine by that because I was salaried. But once that salary was lifted and you see the peek behind the curtain, how is compensation actually calculated? I mean, it became very clear that it wasn't the right model for me. It wasn't how I wanted to practice.
And that's well known by both sides, the patients as well as the professionals, how difficult that is.
Yeah.
And how time consuming that is.
Absolutely. And you know, when we're the ones sacrificing a decade of our life, oftentimes our 20s, some of our prime years, to learn the medical profession, being told by insurers or people with MBAs what's medically necessary and not is incredibly demoralizing. And spending 30 to 40% of our time doing administrative things just to make an insurance job person's job easier, it is ridiculous.
If I was to ask you how you differ from, let's say, a generalist, not a specialist, a generalist, can you articulate the difference?
Yeah, so general practice is an older term. Back in the 90s, they renamed as family medicine. And so in my training, I delivered over 40 babies, assisted with C-sections. I ran a 40-bed ICU as the chief resident. So that's intubating patients, putting in catheters into their necks and into their heart. And you know, I've spent time on trauma services, on hospital wards, in clinics and emergency departments, pediatric clinics, all of that sort of stuff. So when you think of a generalist, it's somebody that has exposure to all of those fields, right? And so every program is different, every residency is different, but in general, if you're in an unopposed residency, which mine was, it was just us, emergency medicine and pediatrics. Okay. No OBGYN, no specialists of any sorts. You get very robust training because it's you or nothing.
You pick up skills in so many different levels.
And when you work with a specialist on that rotation, it's you and the specialist, not you, a specialist, a fellow, a resident, and they're all of a different specialty, cherry picking the easy cases for the generalist. And so while academic institutions are great, especially for medical school, for residency training, if you're in a large academic institution, the scope of practice is going to be a lot more narrow, where a generalist may only spend time in the clinic rather than getting really hands-on difficult cases in specialty realms.
Well, your system is a little bit different. You have a different model that you operate from, and I'm curious, how does that differ from?
Yeah, good question. So in a traditional practice, a conventional practice, insurance is boss. Right, and my very first job ever was waiting tables for Papado. Anybody that's been to Papado knows it's delicious food. But as a waiter, I was making $2.14 an hour. And when I learned that, I was about to quit. And this was my job in college. I needed more than $2.14 an hour. But the manager told me, tell me who pays you, and I'll tell you who your boss is. Right, so each of the tables I waited on was my boss. The service industry at its finest.
Yes.
But what we have in medicine is insurance setting the rules. And the rules that they set are pay per visit. It's called fee for service. And when you have that, the incentive is just about making ends meet. It's all about spreadsheets and productivity. I think instead we should incentivize doctors to keep patients healthy. Have the doctors rewarded the healthier patients get, so that they can help get patients healthy and be rewarded by keeping them healthy. And so with my model, it's $99 a month for adults, $50 a month for children and full-time students. They get a bill every 30 days, set it and forget it. I think a lot of doctors can agree we didn't go to school to learn how to put bills together. And I just focus on the patient. So whether I'm at the grocery store getting some groceries for the week and a patient calls me that they've got a side effect for a medication, I know my patients and I can spend 2 minutes on the phone with them. How do you bill that to insurance? How do you have the conversation and the relationship monetized? And the answer is you don't. You set it and you forget it.
This sounds like something that a lot of people would love to be part of. And I say that because you can imagine how many of my clients in a different field, they talk to me and they tell me, well, I set up a thing, but as soon as I can get into a doctor is, let's see, this is January, I can see him on March 16th.
Yeah.
That's the reality of the way things are. So
I won't disclose where I used to be, but I've been in the community since July 1st of 2020. I started my job in September, and I had 2,858 patients, something like that, in less than 3 years. And what was really heartbreaking was a lot of my patients, they would keep those appointments 3 or 4 months out and prioritize me over a nurse practitioner or a physician assistant, but then forget why they made the appointment because it was so far out. And when you're overbooked with 3,000 patients and trying to see 20 a day, you use your same day appointments to try and follow up on the really serious things, and suddenly you're out of appointments. And as somebody who would stay and take the time to see patients and give them my time in the room, I was already getting home about an hour and a half to 2 hours late every day.
I've always booked my appointments early in the morning simply because I know that they're not as far behind yet as far as they will be during the day.
So my patients got in the habit of bringing in hotspots and laptops, Kindles, newspapers. They would read because I was consistently an hour behind. And now that's not fair to patients. It's not fair to staff to have to stay that late. But when people are waiting 3 or 4 months to get in and they've got a list of questions for the doctor, even if it's a preventative visit or an annual physical and the insurance isn't going to cover those things, I would take the time to go through it because that's what the patients deserve. But instead, in the traditional sense, doctors are penalized for that. They're not as productive. They can't double or triple bill for all of those issues.
The way I see this style that you're doing, it's not only helpful for people being able to get answers immediately, but it's also affordable, which is a big scenario because a lot of the patients that under a normal situation have a quote deductible, and some of those people are struggling. And
they wait until things get bad enough to go see the doctor. And so things that could be nipped in the bud, wait weeks or months until it's bad enough. And by then you may be talking about IV antibiotics for a skin infection that reached the bone, or a thumbnail infection that reached the finger pad. And so on this model, instead of being penalized with surprise bills, use it or lose it, right? You're paying $100 a month anyway. Why not take a picture of that rash and send it to the doctor? Hey doc, what do you think of this? Right? It's like having a doctor in the family, but you're actually paying them, so you don't have to worry about bothering them.
Do you get hounded? Because I know with the world of technology, the patients will feel that they have more of a direct line to you. So it's 7 or 8 o'clock at night, and can they email you, text you, etc.?
Awesome question. So you're absolutely right. My patients get my cell phone, and they can call me, text me, email me in the middle of the night.
And you're still married.
And I'm still married, right? And so setting boundaries is really important. And so when they come to my office and they hear that I spend an hour and a half with them to hear their concerns, when they know they can get an appointment same day or the very next day, they're not as stressed, they're not as worried, they're not as likely to do those things.
And they will probably be very cognizant about taking your time as well.
Absolutely. And so I have great ways of communicating with patients. My ringer is on, so if you text me or call me, I'm getting up. It's going to wake me up. But if you're a shift worker and you're working night shift and it's on your mind and you're going to forget about it by the end of your shift, email me. Send me a secure message through the portal. Those are things I'm not going to see until the morning. And then as far as call and text is concerned, if you've had a heart attack and it feels like you're having another one, there's an emergency department for a reason, right? I'm not the one to stent your heart. I'm not the one to do a bypass, right? If you're a woodworker and you severed a finger, I'm not the plastic surgeon to reattach the finger, right? So if it's an obvious emergency, go to the emergency department.
Sure.
On the other end of the spectrum, if you took your last pill of your blood pressure medicine and it's 8 p.m. and you need that refill tomorrow, don't be calling me, right? That's not appropriate. You should have known that a couple of days in advance.
How would they know all the boundaries?
Yeah.
Is the right word.
I do 30-minute meet and greets.
Okay.
And then my first appointment is an hour and a half. So we have time to go over the boundaries. Now, I've just explained the reasons why not to call me. The examples of reasons to call me is if it's urgent or emergent and you're not sure if you need to go to the emergency department. You're not sure if you need to go to urgent care, or can this wait till tomorrow, right? A perfect example, first-time parent has a kid with a fever, has a seizure, right? The kid absolutely terrifies the family, but it's over in 20 seconds. Kid seems to be doing fine. Drinks some fluids, eats okay, took some ibuprofen. Gosh, that was a seizure. Do we need to go to the emergency department? I don't care what time that is. I am happy to have that conversation.
Okay.
Right? If you injure yourself, I had another patient sliced her thumb on a mandolin, right? If it was only 6 p.m., sure, it's after my office hours, I'd be happy to come into the office and stitch that up. That is not something that had to wait for the next day. And so it takes some encouragement, it takes a lot of communication, it takes a lot of trust, because people are so used to the old way where when they call, they get a call center that may be out of state or even out of the country. And their call is sent to different clinics. A different person may not be their doctor, maybe a PA, maybe somebody on call. And they're told, oh, you've got this one question, that'll be a 3-month wait.
What comes across my thoughts, you're going to, I don't know how long you've been in practice here in Eugene.
Since July of 2020, or September of 2020.
Okay, so basically just year and a half.
Time flies, 3 years.
Okay, when you're having a good time. And so, yeah, might as well carry the 7. So you're right. And so when do you get overbooked? When does that happen, and what are you going to do about it?
Yeah, my vision for the practice is to always be able to accommodate same day or next day visits for my patients, right? There's obviously going to be times where I may be camping, maybe at a conference or something like that, and I can't accommodate it for those reasons. But if I'm in town, if the clinic is open, I need to be able to see them same day or next day. So if that ever happens, I pause enrollments, get my population healthy, and then start bringing on more patients.
Okay.
Now, what the other question that you may be asking is, what does a full panel look like? And so every population is going to be different. I do not discriminate on any medical conditions. I don't discriminate on age. I don't discriminate for any reason. So whether I've got patients that are in and out of the hospital or patients that are triathletes just trying to optimize their health, they're going to take a different time requirement, right? Time investment. Yes. But eventually, if I'm doing my job correctly, they'll be healthy. And I'll be acting as an on-call urgent care for the patients that I know that I grow with. And so there's been many doctors that do this model of care. And so what they tend to say is about 500 to 600 patients is a good full-time equivalent for a job. And so I will be shooting for about that number, but my wife, she's a family nurse practitioner, and so she'll be joining my practice and we'll be able to exceed that.
I see.
But there will come a time
where there should.
Our capacity is full.
Because what you have to offer is going to be attractive to the community.
Absolutely.
Which is why we're having this interview. I want to add something that Dr. Jones just said that hit something that I think about, and that is a lot of doctors will ask about, are you a senior? Are you on Medicare? Why do you suppose they're asking that? Because they have to go through the paperwork that's horrendous, and they tend to not want to take on patients that are on Medicare because of that very reason. So, and you've answered that question already. You do not discriminate against age or...
Yeah, absolutely not. So I've got patients that are unfunded, meaning uninsured. I've got commercial insurance, Medicare, Oregon Health Plan. They even have some that are undocumented. And so the great thing about this practice is that the only people that matter are the people delivering care and the people receiving care. Everybody else is told to get out. And so I can negotiate cash rates with imaging centers, with specialist office, with lab companies like Quest, and I can get all those things at a discount to help those patients that are uninsured and unfunded.
And you pass those on to them.
And even patients that are underinsured, those with really high deductibles that are effectively cash until they hit a threshold, they stand to benefit from all that too. And it allows me to wear the hat of a patient advocate, and I can literally help find less expensive means to deliver the same results for my patients.
You have a lot to offer. Now the question is, and I'm going to point out to the audience here, what is the best way to get in touch with you without interfering with your practice?
Yeah, absolutely. And I don't want anybody to consider it an interference. One of the things that I offer is a 30-minute free meet and greet, and that's a consultation that anybody can have. This is a very different way of experiencing and accessing healthcare, and I want to make sure anybody that joins the practice fully understands how it works, what its limitations are, what it does really well, and set kind of those boundaries for when they want to join. And so that's totally free. It can be done over the phone, virtually, in office to see this lovely space, and there's no problem. If you don't want to necessarily reach out and you just want to learn more, the website is Clear Health, DPC, and that stands for Direct Primary Care, which as a whole is the movement of independent doctors eliminating insurance and third-party greed and just getting that direct relationships with patients.
And we will make sure that your information is on the bottom of the video so that the people that view this, that say, hey, this is a good alternative, I want to check this out, they'll have your contact number.
And so I'll also want to do a quick shout out for the DPC Frontier. If anybody Googles that, they can search over 3,500 practices across the country that have registered with this. So if it sounds too good to be true, you experience it yourself, and you love this style of practice, I'd encourage you to share it with family members that may be out of state, out of the city. There's other independent doctors that are moving the needle in this right direction.
That's a great thing to advise. I'm going to, again, we'll put this out there, and it's going to be on the video that we put together, and it'll be, who knows, it'll play for as long as it plays on YouTube, I think.
Sure.
So Dr. Jones, I very much appreciate you taking the time,
Absolutely.
which is of a premium,
Yeah.
to share with us. So again, Gary Raze, and I'm with Remax Integrity, but that has nothing to do with this. You can always contact me, and I can get you in contact with the person that has put the video together, and we can pass on the information. You're going to be able to get a hold of Dr. Nick Jones with ease because we'll have that information for you. So until next time, take care.